The last theory we will be considering this week is labeled relational theory. Jay Greenberg and Stephen Mitchell were some of the main authors of this direction in relational theory. Background, the relational theory is at the root, and what's at the root of relational theory is the concept of the therapist being a participant in a shared activity with the patient client. So this is a shared reciprocal relationship, one might say. The client experiences an interactional field within which the individual arises and struggles to make contact and to articulate himself. So we see again here, in terms of Scott Miller's earlier stuff, as far as the rapport building and Carl Rogers' material, that in order for clients to be comfortable, one in the interactional field needs to present an atmosphere of empathy, as we had heard earlier, so that the client really knows that you're concerned and connected with what they're bringing to the table in terms of the therapeutic relationship. Techniques of relational therapy include 4 areas here that are the main ones. What's labeled interaction-driven techniques. These are where one expands cognitive and emotional capacities of the client in terms of the encounter with them for the session. The next would be joining techniques. Here, the therapist's alliance and agreement with the patient allows them, in joining with them, to be able to share more comfortably their issues. You'll notice that some of these have some echoes in terms of the motivational interviewing that comes a lot later. It seems to have taken from a lot of different of these earlier approaches, as you will see at the end of the semester. But separating techniques, for instance, where enhancing separation from the patient helps them compartmentalize or separate themselves to be able to consider what are the kinds of issues that are going on and how they may be impacted by environmental elements as well. So we would have here, in terms of the separating, including reality testing, maybe reframing certain situations, exploration, interpretation of events, and uncovering unconscious elements as well. And then the joining and separating techniques: silence, free association, and use of the therapist's fleeting thoughts. And it's important to realize that silence is an important element of therapy, and not to become uncomfortable with it, and allowing silence to have an effect when appropriate. I mean, this takes time to learn, but it isn't a bad thing to have some periods of silence to recoup, to think. There are a number of reasons that one might allow that within the therapy session. Certainly, it's an important part of the method. And then looking at cultural relational techniques. Female developmental theory, originally referred to as self in relation to others, has impacted this. And there will be a specific session during the semester on feminist theory. Female infants do not separate, but instead develop a self in relation to others approach to their friendships and associations. Cultural relations theory suggests women are oppressed by the patriarchal social structure where their relational bounds are devalued and labeled as dependent. So we still today, and even in our political climate, are suffering from an overdose of patriarchal ignorance, I guess one might say, or attempts to amass power and control over others. But more will be said in terms of this in the feminist approach to the therapeutic issues. Theoretical constructs of cultural relational techniques. Mutual empathy, mutual interactive empathy with each person being emotionally available in the session. Relational authenticity, the need to be seen and recognized for who one really is. And we've had elements of this in earlier discussions, and will have in later. about this idea of authentic self. Relationship differentiation, again, ongoing intrinsic awareness and responsiveness to the continuous existence of the other and expectation of mutuality in this regard. Again, differentiation within the relationship and among relationships. Self-empathy, again, the therapist facilitated development of self-empathy as she joins the client in a process of empathic witnessing and acceptance. Schiller developed a group model for women's groups, which I think can apply to other groups as well. But she observed that, unlike the other group theories, women tended to not have the tug of war that goes on in stage 2 in a lot of the development of groups. But she realized that women, after the pre-affiliation stage, attempted to establish some relational base. It's this relational element that allows for more significant work to happen within the group at an earlier point in time, where there's this shared respect for each other in terms of establishing that base. And then mutuality and interpersonal empathy were able to emerge from that experience, and that is the locus of a lot of healing and change in one's life can come at this juncture, because there's this mutual sharing that we're not all, I'm not alone, we're in the same boat. A mutual understanding in terms of empathy of others who may have been there where you've been and have somehow overcome that. The challenge and change section has to do with people within the group context encouraging and challenging others to move from their point of being stuck perhaps in a particular area to exploring other alternatives. And then the termination phase, which is common among groups. There's the beginning stages and the ending stages, so to speak. This model works really well with a number of groups, not only women's groups, but people who have been somehow discriminated against or who have been ostracized. May work well within this kind of framework in terms of how you might understand the process within which the group can best benefit the client. And then the feminist model, as I say, which will be later more expanded upon, again, follows that pretty much direction that Schiller was using in her group, this importance of the relational base and mutuality, which Dr. Chappell will talk about more when she looks at the feminist theories in the later part of the semester. This sums up relational theory, and I will try to upload some links that may be more explanatory of the theory.